been rolling some things over in my mind, and this kind of like really started to lay in my mind like last night. As a health professional, you always want to work along ethical lines. That's something important. And I don't think a healthcare professional should speak badly about another healthcare professional. And I've been the victim of that, being talked badly about for a long period of time. People who don't know you as a person, they don't know your work, but they speak badly about you because they don't like you. Perhaps they view you as competition. And um, I've had circumstances where somebody who's in a line of work within health, but totally unrelated to my area of expertise, speaks badly about me. And I'm not speaking about anybody specifically at this point, but perhaps getting feedback from a patient or the family member of a patient, or hearing a recording or seeing a video of another healthcare professional, you know, perhaps a gynecologist or a general doctor or an internist talking bad about you, and certifying to people that you don't know what you're doing, when I've never had a complaint with licensing authorities. I've never had a lawsuit. I've never had anybody come and act in a scandalous manner in my office. Uh, I have had the experience of once or twice somebody putting something on social media, which afterwards they had to retract, because you can't just speak on emotions. You have to speak based on fact. Now, if you ask me, have you been also guilty of doing something like that? I guess in my earlier years, when I first came back from training, and now doctors within my school perhaps would say something about me, I would lash out, and, and that was my immaturity, that Dr. So and so said something about you, and no, but whatever, and you would say something maybe a bit unkind too, and that's human nature. But I matured quickly and realized that people wanted the show, and this is not about the show. I have realized that there's nothing more important than the concept of family, and offering your services to whoever wants to acquire your services, and that is it. You won't save everybody. Now, I bring this back to something very specific that's bugging me, especially since last night. So, approximately about 2 weeks ago, I saw a patient with a brain tumor, and cognizant of the fact that the technology to do that surgery not available, not in the public sector, not in the private sector, the best advice I gave was, you need to leave the country for medical care. Doc, were your hands itching to do the surgery? Of course, you like what you do, and it's a challenge, but I could foresee, because of experience and knowledge and wisdom, that there were going to be many complications, that even if one were successful, myself, one of my colleagues in country, were successful in removing this brain tumor, there would be complications around the surgery that could make the patient potentially die. So in the after hours, after 5 p.m., I'm contacted by somebody from the office saying, "Hey, doc, remember this patient that you recommended leave the country to get surgery for a brain tumor?" Yes, I do. Well, this patient is in X place. Now, when you advise, you have to advise based on people's pockets. You can't take for granted everybody has money to go to a private institution. So I remember giving a specific type of recommendation about, what country to go to that's around us that accepts our patients, public institutions, two options, where this patient could go for surgery. And surprise, surprise, now I find out that the patient is in a private facility in another country. My experience with The ones I find out about, perhaps these are just complicated cases of my Belizean people who have gone to see a specific doctor in a private setting in another country that's a bit north of us. Um, all the patients that I find out about, they're so complicated, they die there or they die upon returning to our country. So, did I have the legal, well, not legal, but did I have the moral obligation to tell this family who's now going to have a wife being a widow, daughters and sons not having a father, did I have the moral obligation to tell them, hey people, if by chance you all decide to go private and to go to X country that's north of our border and to X city specifically, please do not go to see this specific doctor? Should I have done that? Is that ethical? I mean, all I know about the doctor is fluent in English. That could be something that's an attraction. The doctor is elderly, and the patients that I get to find out about, the track record is not good. But let's be objective. Perhaps this doctor has done surgeries on other people, from our country, from Belize, and the results have been good, acceptable, great. I don't know. Is it that just the high profile patients I find out about and then I have this very bad taste in my mouth? So I'm not stressed, but I'm saddened. I'm saddened because I look back now and geez, would not that have been totally unethical and a lack of professionalism for me to tell the family, please don't see this doctor. See anybody else you want but this doctor. It did not occur to me that they would find the money for a private arena, a private environment to get this medical care. So I never mentioned in none of the two countries that I suggested going, I never suggested a private environment because I could see that these are regular working class people that don't have the means, that would not be able, even if we had the infrastructure, the technology, the human resources, the team to do the surgery here, they wouldn't have had it in private. And of course, private in our country is much more expensive than bordering countries to the north and to the west, right? Hence, you have a link, about places people can go for public care, and hence you give a recommendation because you know how the system works and the possibility of a person who is in need, not dire need at that point, but in need of a surgery somewhere not beyond a month because it compromises their life, to get that surgery done in a place where you have a team of doctors, not one specialist like myself with maybe an internist or a couple nurses. No, you need a team of people. It's a team approach. And here, for example, I'm by myself. There's certain surgeries I would never want to do or I never continued doing because I got away with it many times by myself, but I was younger and I had all the energy in the world to get this done. Now, I don't want to sicken my coronary arteries and end up with a heart attack or with a stroke, right? So, raise my blood pressure, my cholesterol, become a diabetic because of undire stress. So, I've walked away from that. I measure what I can and cannot do, what I can't do. If one of my colleagues in country wants to do it, fine, I'm fine with it. It's not referring a patient to be mean so that my in-country colleagues don't do it. It's you have to know your limitations. So, the information coming back at me last night, and I have no idea what it would be this morning, is describing a patient who basically had one first surgery, apparently tumor completely removed, and I don't know if a day or two after that first surgery, needing a second surgery because a clot had formed in the place where the tumor was. And these complications can happen. I'm not batting the doctor. But the information coming back now, and one of the things that my administrative assistant told me was, what the family was told is, just take him to an ICU in your country to recover. Now, if a patient is in an intensive care unit, the amount of expense in a private ICU, even in a country to the north of us and to the west of us, which could be much more affordable, each day ends up being tremendously expensive. How can a family afford that? Now, pack up the patient. Now I've done my job, and run back to your country to an ICU. But then the only ICU these people will be able to come to is in our one public facility, one government facility that has the capabilities for that. But that trip would have to be obviously by road, and that trip would take nothing short of 8 or 9 hours, because you have to travel from that city that's about 6 hours away, 5 to 6 hours away from the neighboring city across the border in the north, and then all the way down, and even with the paperwork involved, and then a patient coming to an institution. And I don't work in the public realm, but I wouldn't want to be the receiving doctor, the neurosurgeon, or the intensivist or internist that's receiving a patient that, from the description, is basically brain dead. In other words, there's no chance for survival. I find that to be, heart wrenching. It's heartbreaking. My I feel pain for the family in that sense. I can't understand their pains. I can't give sympathy, but I empathize with them, because it's just not possible to bring a patient without the proper ambulances, equipment, personnel from an ICU place that is 8 to 9 hours away, and know that they have space in the public facility that they're going to accept the patient. Now the patient is brain dead. Half the road, half the trip down to us here in Belize, that patient is basically a cadaver. So was my colleague saying, well, I can't do more, and so now I don't want the responsibility, you know, ha, take it. I've done the tumor, I've done the clot, and now the rest is yours. It's a very sad situation. I have to limit myself. It's so hard because, your human nature is crying to the wind and saying, why you went to that doctor? Jeez. I don't know. I think there comes a point in your life when, as a health professional, you have to know your limitations. I have a lot of respect. I have a lot of respect and love for my profession and for people. And I have a lot of respect for this white thing, this white cloak, robe that hangs on the back of my seat, that has my name and the institution that I work for, and what it represents, the greater good. I can't envision doing that type of thing. We all need money, finances, but I don't think you should chase money. Was this family inappropriately advised by some other colleague here in the country? I don't know. I don't know. I don't have the answers. The bottom line is there's a male patient who most likely is in a state of brain death, which means the brain, the computer has shut off, and you're dependent on a life support machine that is asking for help from across a border, a place where I don't have access to, where I don't know all the variables, what happened. It could be that the doctor's effort was very valiant and everything is correct. I don't know. The bottom line is, what can I do when I sit on the outside? I don't work in the public system here. I don't work in that system over there. I mean, perhaps the best advice that that family can have is quite simply, talk with the doctor straight up and find out. I mean, is this the end of the line for the patient? Then, is there no hope? Pull the plug. Just pull the plug. Pull the plug and prepare to bring back either a cadaver or cremate and bring back ashes. Unfortunate. A very unfortunate situation. So today I speak with pain in my heart. Pain for this family, because I remember very clearly talking with them and telling them, if he survives all of this and comes out of it, and if you want, you can look me up to see if there's more that I can do from a neuro rehabilitation perspective in guiding that brain back to a sense of normality. But first, he has to survive this episode. It is sad. Just my people, ask all the appropriate questions and look back and realize I wish his family had reached out to me about the choice they had made, and I perhaps would have told them, before leaving, I don't advise that choice, and just leave it at that. And not give any specifics of what I have seen, because you don't want to throw people or patients, a community, against a specific professional. I think the professional, she or he has to have the capability of knowing at what point you can say, this is not for me. This is Dr. Wiz, and I just came off a TV segment trying to give education about neuroscience and mental health. And I'm happy because of the educational aspect I gave, and I hope this educational aspect helps educate you, my people, whether you're within the borders of this wonderful little country of ours, this jewel of ours called Belize, or you live in some other part of the world. This is my message to you. Ask questions. Ask questions. What if is not the way to go? What if I had done this? What if this? That's not the way to go. Have a blessed day. And I hope to see you soon with another educational topic. Bye bye.